Since its launch in 2008, the Healthcare is a Human Right campaign has transformed the political landscape in Vermont. Together, we have changed what is politically possible in healthcare reform by mobilizing thousands of Vermonters to speak out and demand their human right to healthcare. A universal, equitable healthcare system is now within our reach. We made great strides in 2010. First, we descended on the State House with thousands of petitions and with our own answer to professional lobbyists, the People's Team. The team reported back to Vermonters on what's going on in the State House and helped us hold our legislators accountable. In communities across the state, our local organizing committees mobilized their families and neighbors, held public events, and educated our elected officials on the need to provide health care as a public good to all Vermonters. As a result of this organizing, legislators began to debate real health care reform. A bill that later became Act 128 committed Vermont to treating health care as a public good. It included all of the principles put forward by the Healthcare is a Human Right campaign: universality, equity, accountability, transparency, and participation. On May 1st, 2010, over 1,000 Vermonters converged at the State House to call for the passage of a universal healthcare bill. A few weeks later, Act 128 was passed and signed into law. The Healthcare is a Human Right campaign had achieved its first legislative victory. But we got right back to work, mobilizing more and more Vermonters. During the 2010 election season, we held 15 people's forums all over the state, attended by over 130 candidates and many hundreds of Vermonters. Our message was heard loud and clear at the ballot box when Vermonters elected Governor Shumlin, who ran on a universal healthcare platform. In January 2011, we once again kicked off the legislative session by packing the State House and delivering a petition signed by over 4,000 Vermonters demanding real healthcare reform. As a result of our organizing, universal healthcare was on everyone's mind. Meanwhile, Dr. Shao of Harvard University had been selected to develop the plans for a new health system as called for by Act 128. Soon after the start of the legislative session, Dr. Shao presented his proposal for a single-payer system to the Vermont legislature in a room packed with healthcare as a human rights supporters. On the heels of Dr. Shao's report, the governor introduced a healthcare bill designed as a roadmap for a universal healthcare system. In response, our campaign has mobilized across the state to strengthen this bill. Hundreds of Vermonters testified that this bill must create a universal, equitable healthcare system that provides healthcare as a public good for all. Over the next weeks and months, we will be redoubling our efforts to counter the scare tactics employed by deep-pocketed health insurance profiteers and their allies. Now more than ever, we need to keep organizing and building our movement for a healthcare system that works for the people, not for corporations. Vermont can lead the way by creating a universal healthcare system that provides healthcare as a public good for all. This May Day, join us for the biggest Healthcare is a Human Right rally that Montpelier has ever seen. Bring your friends and family and speak out against the insurance industry and for our human right to healthcare. Join us. For more information, go to www.healthcareisahumanright.org.